This is our third of three in a three-part webinar series on regulatory policies for vaping. And my name is Rob Schwartz. I'm actually filling in today for Emily Taylor, who was not well this morning. I'm just going to moderate. The speakers for today are Shawn O'Connor and Daniel Eisenkraft Klein, and our discussants are Flory Doucas and Hagen. Our discussants are our panelists. We are really excited to be talking today about regulatory options for e-cigarette marketing in Canada. The first two webinars focused on product regulations and on regulations for flavors, for selling flavored e-cigarettes. And recordings of all these will eventually be put up on our website, but that might take a little while. The goal of today's webinar is to assess the evidence for a range of policy options and to discuss the feasibility of implementation in jurisdictions across Canada. The report that is the basis for this webinar was developed with support from Health Canada through Physicians for Smoke-Free Canada under a SUAP, Substance Use and Addictions Program grant. I'm going to introduce our speakers. Shawn, my colleague, Dr. Shawn O'Connor, is a senior research associate at the Ontario Tobacco Research Unit at the Dalla Lana School of Public Health, University of Toronto. He is a recognized expert in surveillance of tobacco, electronic cigarettes, and cannabis products and their population-level outcomes. His current research focuses on tobacco and vaping, with an emphasis now on how packaging is being used to promote industry products. I'm also delighted to introduce Daniel Eisenkraft Klein. Daniel is completing his PhD at the Dalla Lana School of Public Health at U of T. His research is situated at the intersection of political economy and public health policymaking, with a particular emphasis on commercial determinants of health and substance use. And Daniel did much of the work for all three of the reports that are behind these webinars. Also introduce our panelists now. Hagen, well known to many, if not all of you, is the Executive Director of Action on Smoking and Health, one of Canada's leading tobacco control organizations. For the past 3 decades, Les has been providing regional and national leadership to reduce tobacco use in Canada, and he's helped to secure numerous important policy measures at various government levels. ASH is based in Edmonton and has a staff in all 4 provincial capitals in Western Canada. Flory Doucas, returning once again. I think she's been on all of our webinars, and it's wonderful to have you back, is the co-director and spokesperson for the Quebec Coalition for Tobacco Control. She completed graduate studies in health and prevention at Université de Montréal. She has worked for over 15 years in tobacco control with groups such as Non-Smokers' Rights Association and Physicians for Smoke-Free Canada. She's played key roles in campaigns to ban asbestos mining in Quebec and reduce exposure levels for workers and the public. She is the co-director and spokesperson for the Quebec Coalition for Tobacco Control, a group known for its research and its capacity to mobilize. She's got a lot of accomplishments to her name, but I'm going to leave those out for now, if that's okay with Flory. And I see a little bit of a smile there. So we're going to go right into it now. I'm going to moderate the chat and the discussion. So likely we will get to Q&A at the latter part of the webinar. If there's something that's really vital that comes up, we will bring it to the attention of the speakers at that time. But the format basically is we'll start with Daniel Eisenkraft Klein, go to Shawn O'Connor, and then we have some predetermined questions for our panelists, which will stimulate more discussion from all. So over to you, Daniel.
Great, thank you. Okay, good afternoon, everyone. I'll jump right in here. So to start with, in Canada, with the legalization of e-cigarettes in 2018, the federal government opted to take a different approach to marketing from combustible cigarettes. So essentially, most marketing and promotion was allowed so long as it was not youth appealing at the time. And then other stipulations prevented misleading advertising and sponsorships, but there was made a clear distinction between marketing of e-cigarettes and marketing of combustibles. Now, 2 years later, we have 29% of youth in grades 9 to 12 reporting using e-cigarettes over the past 30 days, with 40% of them being daily users. And aggressive marketing has been highlighted here as one of the key contributors to this surge. And most youth who do smoke e-cigarettes report that they have seen those advertisements. So actually, Kreitzberg et al. Just last year in 2019 really did an excellent review of the studies on the effects of e-cigarette marketing. It was a lab experiment including randomized control trials, and this real-world study, the effects of e-cigarette marketing showed that following 5,500 students who were between the ages, they were in college, so between the ages of 18 and 24, they found that exposure to e-cigarette marketing predicted e-cigarette initiation and sustained e-cigarette use. So that was one of the first that really actually could connect what a lot of public health experts and researchers have been saying more anecdotally. That said, there is limited direct research that evaluates the effectiveness of e-cigarette marketing restrictions. And that could be in part because just the difficulty of confounding variables to do cross-jurisdictional studies. But that, in terms of next steps, is quite needed. Right now, I think we've seen from looking at other advertising restrictions, whether it be alcohol or tobacco combustibles, pharmaceuticals, that restrictions on advertising work. And I think we could certainly suspect that it would work with e-cigarette restrictions as well, but the studies still have to be really done. So this is from 2 Environics research public opinion surveys to compare exposure to a variety of advertising sources. And this was conducted online between February 4th and 26th, 2019, and it included young vapors, ages 15 to 19, young adult vapors, 20 to 24, and then adult vapors. And you can see that the number one source of promotion here is online through social media, in fact, quite distinctly above all others. And of those, 27% were exposed over Facebook, 25% over Instagram, 19% on YouTube, 11% on Snapchat, and 7% on Twitter. So in terms of discussions going on about ongoing regulation of where to target, clearly just doing isolated targeting of particular social medias is not going to work. Young people are seeing these across social media platforms. And then other forms of advertising, including on YouTube here, include online videos. And in 2018, and this was published in 2019, but the work done in 2018, researchers discovered over 8,000 Juul-related videos that received a total of 260 million views over the 3-year period from 2016 to 2018. And the majority of those were on channels that appealed to youth. So some of the regulations have changed since then, but it's clear that companies were intentionally putting these in places where young people would, despite what they may say. Now in Canada, Canada's Tobacco and Vaping Products Act provide a framework for regulating vaping products, and Health Canada has proposed new regulations to put limits on advertising and promotion, particularly advertising that's done in a manner that can be seen or heard by a young person. And then there was a notice of intent from Health Canada in November 2019, where all 13 provincial and territorial governments strongly recommended immediate regulatory measures to reduce youth uptake of vaping products, including restricting all forms of vaping advertising and promotion that would align with those in place for tobacco products, which is, relatively speaking, quite strict. And then, so 11 of 13 provinces and territories have general legislation on e-cigarettes, and all 11 of those ban visible product display of e-cigarettes, as well as e-cigarette advertising at retail stores. But exceptions continue to be made for specialty vape stores. So that's a key gap right now that hopefully we're going to talk about in terms of a next area for legislation. With that said, Saskatchewan, Manitoba, Quebec, Nova Scotia, and PEI all have banned e-cigarette advertising on billboards and outdoor signs. And then Manitoba, Quebec, Nova Scotia, and PEI have also prohibited broadcast advertising. So some provinces are taking on themselves to do targeted advertising restrictions. In our report, which you'll find a link to on our website, on OTRU's website, there is a whole lot of different jurisdictions. There are a whole lot of different jurisdictions that are taking on their own regulatory policies outside of Canada. In the US, by state or even within states, there are ads being done on websites and mobile apps, and some states have tried to restrict those or target those. In New Jersey, there are ad bans on transit, especially because those are often targeted at the people who are taking transit, often lower middle income people that e-cigarettes often have an appeal to. Promotional elements of packaging is prohibited in general in the European Union. And then in Ireland, websites can't promote e-cigarettes or refills by offering discounts. So there's another element of marketing restrictions that look at pricing and ways in which pricing can actually be restricted within advertising regulations. So hopefully we don't sound like a broken record here, because we've been talking about this balance for the last 3 presentations, but in considering which regulatory policy options to pursue, there's always going to be this tension between the overall use of nicotine in society, young non-smokers, and smokers in support of quitting and harm reduction. We could maybe make a distinction here from marketing, because the argument for the need for current smokers to take up vaping doesn't align as well with the need for marketing. In general, smokers know that e-cigarettes are available to them, and it seems like actually these advertisements are quite rarely even targeted at current smokers, and actually much more often targeted towards young potential vapors, and often, most often, ones who have never smoked a cigarette and likely never would. So hopefully we can make some distinctions from the other 2 reports around regulations and flavors, that marketing actually is a different kettle of fish. Okay, so with that, I'm going to turn over to Shawn, and he's going to take on some policy options that we can use from here.
Thanks, Daniel.
Great.
So there's one question so far in the chat. We'll get to it a bit later. Go ahead, Shawn.
Just give me a few minutes. I just got to get my slide deck going. So.
Absolutely. So while Shawn's getting his slide deck ready, the question is around whether there is appetite for provincial messaging campaigns to counter all of the advertising being done by Juul and others. But I see that Shawn's all ready to go. So we will address that question a bit later in the chat. Shawn, do you want to move into slideshow mode?
Okay.
If that's a challenge, you can do it this way too.
Shawn, I can also buy you time by answering this question if you want.
Sure. Yeah. Yeah. I'm just trying to sort out my sharing here.
We see your slides. It's just not in slideshow view.
Okay. Perfect.
You can go the way it is if you like.
All right. Can folks see my slide then? E-cigarette marketing approach and discussion.
Yes.
Perfect. All right. Are we set to go, or any other questions?
Go for it.
Okay. All right. All right. So this this report that we're talking about today, it's really it reviews, it does a jurisdictional scan and reviews individual policies. But what we're focusing on in terms of the discussion on this report is just the major policy approaches to regulating e-cigarettes. So I've listed a number of approaches that one could take, ranging from no restrictions to comprehensive bans. And so you could do industry regulation, you do partial marketing bans, you could have bans that are related to youth, bans that are related to adults, or you could do a comprehensive ban. So we're talking really about these approaches one would take as opposed to individual policies. Having said that, I'm going to just jump into a few individual policies just to lay some foundation. I know Daniel had just presented the last couple of slides. He presented a jurisdictional scan from around the world in terms of the EU and California and Ireland and so forth. But the policies that we're looking at here in marketing are, it's been framed as the 4 Ps: product, price, place, and promotion. The report is focused heavily on promotion, but the other ones, these other aspects of marketing also come into play in the jurisdictional scan. So for product, for instance, this could be the brand names or line extensions, the packaging, flavors, or even health warnings. So we see here, looking at these descriptors across, these are all candy and desserts, which are...
Shawn,
yes.
Sorry. Are you able to advance your slides? We're still on the title slide. Somebody suggested pressing F5. I don't know if that will help you.
Let's try that.
There you go.
Perfect. All right, so did people see this?
No.
Oh, okay. Right. All right, so my apologies. So again, we're talking about kind of classes of restrictions or approaches of bans as opposed to individual policies. And so here's some classifications that we've used. And I won't repeat them, but you can see them there. And those are the ones I just previously discussed. So are folks seeing this chalkboard slide now?
Yes.
Right. So here's the 4 Ps of marketing in terms of product, price, place, and promotion that I previously discussed. And so the product slide, we see here, as I mentioned, the top images are the branding of these is such that they're prohibited because you're not supposed to advertise or promote based on candy and desserts and so forth. And even the bottom 3, you've got a popsicle for the first one, a creamsicle that is, and cookie twist. It's banana oatmeal cookie, and then the last one has this image of a dessert on it, a custard as well. So that's the type of in product. It also relates to other things like around the packaging and even just the physical the makeup of the product in terms of the chemistry and everything else in terms of the product. But that part isn't marketing. Price is another aspect of marketing. This email came to me a couple days ago, 40% off. So price can be discounts, bulk deals, free delivery, reward points, and so forth. We saw in one of the previous slides, Ireland has done a good job at prohibiting many of those aspects of promotion around price. And promotion is we see this all the time, whether it's in retail, online, and various other places. Place is another aspect of marketing, which would be, a good example of that is in tobacco, where they prohibited point of sale advertising, and cigarettes are behind the wall type of thing in terms of placement. But that's just to give you an idea of some of the policies that we're talking about. We're not going to get into individual policies. We're talking about these classes of policies. Here's just one more on promotion. This is online promotion. So we see the frosted sugar cookie e-liquid is an amazing dessert flavored one. And this is prohibited, but again, I picked this up last night. So again, we're talking these major classes, and we are looking at these in this report with the individual policies kind of going into the jurisdictional scan that we report upon. What we're doing is we're assessing those 6-odd approaches that was in the last slide, and we're assessing them based on these 4 factors. So the effect on youth and adults in overall nicotine use, the technical feasibility of implementing such an approach to a policy, the political viability of implementing such an approach, and the alignment with international trade obligations. So we speak about each of those policies in the report, and we address each of these previous factors. So just give me a sec here. Yeah. All right, so for the one policy approach is having no restrictions. So thankfully in Canada, we're well beyond that. We have started to implement restrictions, and obviously, no restrictions isn't going to help youth and young adults and non-smokers. And research has suggested there is strong support for some level of restrictions. So again, we're happy to say that we're not here. We move beyond this stage. Industry self-regulation is another policy approach, and this can be used by the industry to deflect legislative action. You don't have to legislate; we'll do it ourselves, type of thing. And these codes may be developed or changed to render previous violations acceptable. So the industry, if they're getting caught on certain things, they can come out and say that they're doing certain types of voluntary policies to try to protect their profits and so forth. So this is technically feasible, this type of approach to policy making in terms of industry self-regulation, but there is a high political cost to it in terms of the general public isn't particularly keen on letting the industry self-regulate, as are number of government officials. Partial marketing bans is another broad approach that one can take. I put here, for example, broadcast media, billboards, print and streaming services. We found that within tobacco, this has been largely ineffective, these prohibitions. As alluded to earlier, these types of advertisement and marketing promotion, it really creates an enforcement challenge. So if you close down one channel, another channel pops up, and we see that with print media, and more recently with social media and streaming services. Very tough to shut them down, shut the idea of the ads down if they can roam from one channel to another channel. There's a political calculation of the relative cost of partial bans on smokers. So it may be good for smokers versus the relative. The cost of partial ban on smokers versus the relative gains that bans would have on youth. So it's good for youth, these bans, but there could be a cost to smokers. That if you're not promoting or advertising to smokers, for instance, the argument is how would they go about learning about e-cigarettes to potentially switch to a less harmful product than cigarettes. Another policy approach would be to restrict so as not appealing to youth, and this has had widespread acceptance in Canada, in part that it's politically feasible. Politicians want to portray themselves or come across as fighting the good fight and going after the industry that is appealing to youth, and coming up with policies that are focused on youth is a plus for them. So I have here, given the legal precedent, one would need to prove that there are reasonable grounds to believe that the advertisement at issue could be appealing to young persons, in the sense that it could be particularly attractive and interesting to young persons, as distinguished from the general population. So this is a fault, I guess, or this is a challenge, I guess, with coming out with youth policies, is that there has been, with Supreme Court, there has been this legal precedent that, you know, if the marketing and promotion is directed toward the general population, even if young people are seeing that, you know, an industry may not be in prohibition of legislation. That is because it is being directed toward the general population. So that's a little bit of an issue that has emerged from this notion of legislation that is appealing to youth. It gives the industry lots of leeway to market their products. They can just say they're marketing to the general population, and they can, that, like I say, that legal precedent kind of, to some extent, gives them some level of protection. Another approach would be to restrict to adults only, and so this has been done with tobacco. We see that there's adult venues and channels just for adults. It does create a little bit of a challenge for social media, because everybody has access to social media, or you know, for the most part, everybody has access to social media. And this notion of restricting marketing to adult-only channels is considered a normal practice. But if you are restricting just to adult smokers, it could be seen as problematic. And this would be in terms of political viability and technical feasibility, and even just you know, international agreements, in terms of there's legislation out there that you know, it's okay to target kind of everybody, like, so all adults. But if you're picking a subclass like just smokers, there could be could you open yourself to some challenges from the industry. So the last kind of policy approach that we talk about is this notion of a comprehensive ban. So this is just really an intensive approach. So it's kind of like a lot of the policies we've talked about that are in the report, and we've mentioned today, to kind of throw them all together. We've found that within tobacco that this has shown quite effective at reducing youth uptake. With e-cigarettes, though, there's a little bit of a challenge that's not there for cigarettes. You know, a complete ban, it leaves the e-cigarette companies with no way to promote their products to smokers. So we have that notion of, we don't want youth and non-smokers to take up this product, but we want smokers to switch to this product. So if there's a complete ban, where does that leave that latter group in terms of smokers? And so that's just one of the challenges that we need to kind of walk through. Enforcement has been and could be a technical challenge because there's a high cost in part, but it's a challenge for surveillance and laying charges, and then the legal challenges that would result from that. So there is a fair amount of public support for kind of comprehensive ban, kind of like tobacco, but the e-cigarette industry would likely be supported by general business interests like the retailers, and in opposing a complete ban on marketing. So in conclusion, one needs to consider the following kind of effects. On the one hand, as I mentioned, there's non-smokers, youth in particular, and the overall use of nicotine and the potential e-cigarettes to support smokers in quitting and harm reduction. So there's that kind of dual issue that it's you know, policy bans and prohibitions may be good for non-smokers, it may not be good for adult smokers. Other considerations include the technical feasibility of any given policy, the political viability, the political viability. And then there's also alignment with international trade agreements that we've signed on to. And the report, for each of those approaches, the report gets into each of these aspects and briefly talks about each of these components in relation to those policy approaches that we've been talking about. So moving forward, the regulatory approaches to date, they haven't prevented young people from becoming users of e-cigarettes and from becoming dependent. So we're at a point that a number of jurisdictions across Canada have been moving forward. We need to kind of raise the level so that we get more people moving forward in the right direction with policies that meet those kind of criteria as previously mentioned. All right, and that's all I had.
Okay, fantastic. Thank you, Shawn, and thank you, Danielle. That ends sort of the frontal presentation of the information here. We're going to get a little more interactive. In a minute, we're going to go to our two panelists. But before we do so, we do have two polling questions for everybody. And I'm going to ask Sonia to put up the first polling question and just quickly go through this. So please let us know what best describes your role related to e-cigarette policy regulation, just so we have a sense of who's on. We have upwards of 175 unique participants here, and so it's just good for all of us to know from one another, like who's with us today. So lots of people identifying as public health practitioners, and let's see. 73% have voted now, and I think we can pretty much end it now. So about a third of you are public health practitioners. We've got 13% advocates, 10% policymakers, and 12 or 11% of researchers, clinicians, etc. We've also got a bunch of students and enforcement officers. So that is great. I'll just share those results with you. So you can have a quick look and know who is with us today. Fantastic. Now we are going to go straight into the second poll and just ask Sonia to launch the second polling question. This is, again, is for everybody to ask, to answer. So what do you think about the current level of marketing regulation? You can choose like overall, federally, provincially, or territorially, or put them all together. Just give you a second to answer that. Some of you are so quick to the draw. I'm impressed. And while you're answering, I do know that there are, I've got several questions from the chat that I've listed. So just to let you know that they are being paid attention to, and we will bring them forward as we move along here. And so I think we can end the polling now, and we see, surprise, surprise, the majority of you think that there is much less regulation than you would like. And to most others, slightly less regulation, and very, very few think there is too much regulation on marketing now. So that gives you a sense also of who is with us. And we're going to stop sharing those. Oh, did we share them? Shared the results. And quick, we can stop sharing them now. And we are going to turn to our predetermined questions to our panelists. And so, yeah, if I could now, for some reason, can't get it up in front of me, but I know what it is. So here is a question, there we go, for Flory and for Les. And Flory, if you'd like to answer this one first, then we will reverse the order for the second question. So to what extent do policymakers in your jurisdiction perceive e-cigarette marketing to be a problem that requires policy attention? So Flory, a couple of minutes for that, and then Les. Go ahead, Flory.
So Quebec is one of these jurisdictions in Canada that has a very comprehensive restrictions. They're aligned on the tobacco restrictions, and so the only form of advertising, I'd say traditional advertising, so I'm leaving out, you know, advertising on packaging and flavors and all kinds of stuff like that, and price-based promotion. But in terms of traditional advertising, what's allowed is print advertisements in publications that have an 85% adult readership. And so we did ads in newspapers, and that's what it means. It's pretty much any general newspaper or magazine, and we did see ads for vape, sustain advertising campaign. And although our act prohibits advertising on social media, again, as was mentioned by our researchers, that is the principal form of advertising that our youth were exposed to. It posed an enforcement challenge on that. And so, yes, I think our legislators are concerned with the advertising, but I think Quebec has gone pretty far in what it can do, and it is looking federal leadership here to just stronger provisions. I'll leave it at that for that question.
Thanks, Flory. Les?
Well, out here in the West, things have been pretty busy, even lately through the COVID epidemic, and 4 out of 6 provinces and territories have taken some form of action, regulatory action on vaping, and are all pursuing regulations to address aspects of marketing. In BC, the government is pursuing a nicotine limit cap on nicotine products, vaping products. They've put retail restrictions in place within the last few months. They're looking at packaging requirements. Alberta has introduced legislation to ban displays and promotions, and to further restrict public use of vaping, and to align it with restrictions we have on cannabis consumption. And then Alberta, Saskatchewan, and Northwest Territories are also pursuing flavor regulations. So there's lots happening despite the circumstances. And we've seen some polling here too in Alberta recently showing that there is still strong support among policymakers, in fact, pretty much equal to the general public, regarding the need for regulation and further regulation. I want to impress upon everyone too that our chief medical health officers across Canada have issued several warnings about the risks of smoking and vaping during this pandemic. So I think that gives a little further incentive for those of us to keep working. So I would say that the concern overall, Rob, hasn't waned, but COVID-19 is certainly a distraction for everyone right now.
Yeah. Yeah, so I mean, it sounds like both in Quebec and in the Western jurisdictions, their policymakers do feel that this is a problem in need of policy attention, and are giving it some attention. As Flory indicated, enforcement is an issue, and Shawn and Daniel both address the challenges, especially of social media. But Flory's bringing up even mainstream media enforcement is a problem. So, I'm going to go to the second question, which is, to what extent is addressing this problem impeded by perceptions that e-cigarettes help tobacco smokers more than harming non-smokers? So I mean, the situation really is that, even in Quebec, that's gone pretty far, there's still marketing. In the Western jurisdictions, there's still quite a lot of marketing. The federal government hasn't imposed many restrictions on marketing at all yet. Maybe we're going to see them. To what extent do you think this is because the policymakers feel that e-cigarettes are a real solution for smokers? We'll go to Les first.
Well, Rob, I think the vaping lobby has done a really good job of making their case to policymakers, even if the information presented is false in many cases. I know in Alberta, they distributed postcards to our MLAs indicating which flavors actually help them quit smoking. So that seemed to have some traction with MLAs. It was an organized campaign, and something that wasn't exactly spontaneous, but it had an impact on our legislators. I think there is also a split in the academic community, although those who favor some of these, who favor less regulation appear to be more vocal and aggressive than those who don't. So I think it'd be good to hear from some of the academics who think that we do need more vaping regulation. Recently, we've heard that the federal government has introduced restrictions on advertising and promotion, and in so doing, it said that it's protecting kids from advertising and promotion, and any kind of advertising or promotion that can be seen or heard by young people. And I think it would be ideal if the federal government would apply the same philosophy to other forms of marketing that are affecting young people, including flavorings. So any flavorings that could be harming kids or could be attracted that kids could find attractive. And it's pretty obvious that kids prefer kiddie flavors, and the federal government's own surveys demonstrate that kids prefer kiddie flavors, and that there are other flavors out there, including tobacco, that can still help smokers quit without attracting hundreds of thousands of teens to the vaping market.
Thanks, Les. Flory?
Yeah, I agree with Les, and I think one of the things that's undermining the legislators or regulators moving forward is just the lack of overall knowledge that Canada has a regulatory track that would allow for any of these products to be certified as medicines or devices that help smokers quit. And the fact is that no manufacturer has bothered to go through that track. I mean, that allows advertising of those products specifically for cessation. And yeah, I think the industry has been very agile capable in its messaging to just circumvent and put that track, that regulatory burden away. And it's very unhelpful to public health. And I think it's also important to just kind of contextualize some of the provisions, and Shawn mentioned about some of the barriers that regulators might face with kind of a comprehensive or thorough, robust restrictions on advertising. And the fact is that the very act, the federal act, one of its mandates that we've spoken a lot about protecting youth, but another purpose of the act was to protect non-users, and those can be adults. And I think that there's a very poor job of protecting young adults currently in Canada, in the sense, and even with some of the provisions that were put forward by the federal government, upcoming, I guess, are considered would allow for very dynamic advertising through video in bars and so on, and that's clearly would allow the industry to associate their products to lifestyles. I mean, it's not the same as allowing ads in bars that we allow for tobacco products. Allowing for videos allows you to have videos running over a DJ, over different things, and so that creates a very, very strong lifestyle advertising or association. And so I think that we haven't done a good job of just saying that there's a problem that needs to be addressed. We're not in prevention mode at this point. And so in terms of the legal or trade agreements, impediments that we make, the fact is that we need to remind ourselves and to remind others that we are reacting to the fact that there's a huge surge in uptake of vaping products, not among smokers, but among non-users. and youth, and that's what we need to address.
Thank you, Flory. I think you make an important distinction that we often miss, which is that we distinguish between young people and older people, but actually there's the young adults who can legally purchase and who the industry can still market to directly legally, and uptake amongst young adults, so between the ages of 18 or 19 and 22, is a really interesting research question that we need to look at carefully to see to what extent are non-smokers in that age group becoming vapors of e-cigarettes. So thank you for those remarks. I'm just going to ask Daniel and Shawn if you want to weigh in on any of these first two questions at this point.
Yeah, there's been so much that I want to address. Yeah, I think the data shows most people are starting when they're young, so it's worth it's not 50-50. Most people are starting to smoke e-cigarettes when they're younger, but the distinction should be made. I want to mention something that went back to an earlier conversation about self-regulation, as pointed out, because I think when we put in some of these policy options, we're not trying to advocate for them, or even, and I think maybe it comes off as legitimizing them by saying self-regulation is a viable one. It's more that it's one that we hear being proposed or put to government, and so we want to take it up to show the issues with, as opposed to saying this is a credible approach. I'll sort of stop there for now.
Okay, thank you. Shawn?
I'm good.
Okay, great. Just looking at the time, maybe we'll come back to the preset questions a bit later, Les and Flory, but there's a lot of discussion going on, and I want to bring that in a little bit. So I'm going to start with some of the earlier questions that came up. One was, is there any appetite, and I'll ask Les and Flory to address this. Is there appetite for a provincial messaging campaign to sort of counter the marketing campaigns of companies like Juul and Vape, etc.? Do you see that in your jurisdictions? To what extent are the governments actually investing in public education? Flory?
So they're certainly investing in some public education. They're also investing in campaigns for encouraging parents and teachers to speak to young people and things like that. And while I think that those components are important, I think intuitively it's the easy solution to go to for government. I think that those are not adequate substitutes to rival with industry marketing and the amount of money that has been dumped in Canada to promote these products to young people and to non-smokers. And so I don't think that that's an adequate substitute. You can go to it, and I think it's a very easy approach for governments to go. It's quite a timid one, but we need something to go beyond that.
Les?
Well, I think we need to take some lessons from tobacco control and all the success we've had in the past few decades in reducing and preventing tobacco use. And you can't really point to one single measure, but there are a number of evidence-based approaches, including tax increases, marketing restrictions, mass media campaigns, restrictions on public consumption. We just have to apply these lessons. And I think it's no better articulated than in the consensus statement that was prepared by Canada's Chief Medical Health Officers of Health earlier this year. And there's the song sheet. If anyone's looking for a playbook, what should we be doing on vaping in Canada? Let's just listen to our Chief Medical Health Officers.
There's a lot of discussion here about enforcement, and the speakers and the panelists you've all mentioned, I think, challenges of enforcement, in particular social media, but as Flory mentioned, also in the mainstream media. Is this a lack of political appetite to actually enforce? Is it actually feasibly, like a question of feasibility that we don't know how to enforce these restrictions in this day and age? Is it a lack of resources given to enforcement people? Is a lack of clarity around what the restrictions are so that enforcement people don't know what to do? Les, you want to start with that one?
Are you talking specifically about social media, Rob?
I think that's a main part of it, but not only.
Yeah. Well, I mean, social media, it seems on the surface, it appears to be very uncontrollable. But the reality is there's a handful of big players out there. YouTube, Facebook, Snapchat. And if Health Canada simply went and had some polite meetings with some of these folks and sat down and said, would you please comply with the spirit of this new legislation? Kids should not see or hear vaping promotions. I think they would get pretty good uptake, especially if they informed all of these providers that they were prepared to regulate if they don't clamp down themselves. But I think in general that these companies are willing to cooperate and have put all kinds of, right now, they're putting all kinds of restrictions in place around the US election to ensure that their platforms aren't being used for monkey business during the federal election in the US. Well, you know, I think they would definitely listen to Health Canada.
Flory? Why isn't Health Canada doing more then?
Health Canada has a bad record, a poor record in terms of enforcement when it comes to advertising. And basically, whenever things have been iffy, they've changed the law. It's taken 10 years or whatever, 20 years, and a law has been, and that's how enforcement has come to be more adequate when we think of lifestyle and things like that, and testimonials. I think that, you know, with all due respect, I think that we have faced a very rogue industry. Products, the marketing and the sale of these products was illegal before, prior to 2018, and yet we saw them all over Canada being sold. And so I think that there are challenges with respect to enforcement, and especially in terms of the vape shops. As we've seen, even in terms of the flavors that have been prohibited and were prohibited now for years, and there's still not adequate enforcement. And there's an understanding that it's taken more time for the industry and the smaller players to understand the meaning of these provisions. So I think that, you know, there's a lack of money for proper enforcement. There's no paid licensing to sell and market these products, which is not the case in the US. And so we're always playing catch up with respect to the industry. And the industry has had no impetus to focus on most effective or safest products, and has just flooded the market with all kinds of flavors, all kinds of flavorings, all kinds of devices, all kinds of technologies. And, you know, I think it's very hard to have very clear guidelines with respect, and a very coherent understanding with respect to enforcement. So I think that the market is actually not conducive to a very proper and thorough enforcement, unfortunately.
Can I add? I think that when we're asking social media company, with all this, there's this. It's worthwhile to remember that businesses have a statutory obligation to their shareholder to maximize. So the expectation of any company to do what's against their financial interests is unrealistic. And frankly, if I was a CEO, why would we expect that? They shouldn't be doing that. Their job is to maximize profit. So I think we've seen the places where social media companies have taken steps have been where there is profit on the line, whether because of a public campaign or because government is going to legislate it. I think generally, actually, the evidence has been quite the opposite, that they at every turn try to avoid legislation, and anything that gets back to sort of a positive intention, they will counter with a free speech case, where they make the case that, you know, they want to give everyone a chance to put their voices out. I also, can I just quickly comment, in terms of the public education campaign, we've seen a lot that have failed because they're pushing kids, telling kids, youth what to do. One that has worked with combustibles in the past has been just teaching them about the practices of tobacco companies and just showing that they are trying to, they're trying to pull the wool over the kids. I have wanted to do the same thing with e-cigarette companies to show a similar, because they do take different strategies, to show a similar strategy done through a much more 2020, 2019 approach to show that, not say you need to do this or don't do this, but just to show this is how they're targeting you. They think you're, that they can get you, and leave it to them to decide how much they want to push back at that. So that's a different public education campaign maybe for 2021.
Thank you all. So I'm trying to follow the discussion, which is very active, and thank you to those who are participating there. And I apologize that I'm actually not going to have a chance or ability to bring everything up orally, but there's been quite a lot of talk about the fact that there is a young adult recreational vaping challenge here in Canada, and that when we talk about restricting advertising or restricting marketing, we shouldn't talk only about restricting marketing to children. So that came through in Flory's remarks before, and has been partially addressed. There's also talk in the chat about what the expectations we should have that Health Canada is actually going to move quickly and decisively to substantially reduce the marketing of e-cigarette products. And there's a bit of discussion about whether comprehensive bans are more or less difficult than partial bans to enforce. And I'm just wondering if either the speakers or the panelists want to say anything further about any of those things at this point. Shawn?
Yeah, I can just reiterate kind of a point that was made in the chat, is that, it may well be easier to enforce a comprehensive ban than select policy restrictions, and that's because if you implement specific policy restrictions, there's always ways. It's a slippery slope. There's frequently ways for the industry to get around those. Where a comprehensive ban, it just it kind of covers a lot more bases, and it's I think in tobacco, I think it has been somewhat successful in that it just takes away a lot of the avenues to go around or circumvent these policy restrictions by being comprehensive. And we've seen that with secondhand smoke bylaws, and but one could pick any particular kind of policy initiative, but secondhand smoke is a good example, right? When you have partial bans, it was challenging. When you come up with a complete ban, it makes things a little bit easier. It makes enforcement quite a bit easier as well.
Yeah, I mean, the research that we reviewed on marketing bans, it was very clear that partial marketing bans don't work. The more comprehensive the marketing ban is, the more likely it is to have an effect. And so the partial bans that we are, incrementally adopting and trying to enforce in Canada are not likely to, from the experience of tobacco anyhow, to be very effective. Another point that came up in the chat is about comparing cannabis regulations on marketing and e-cigarette regulations on. I've done a bit of that comparison myself, and it's interesting because the legalization of cannabis and the legalization of nicotine vapes came about in the same year, 2018, and cannabis came in with a much stronger restrictions on marketing. So I don't know if anybody would care to venture into that territory.
Well, I think it was the perfect storm, Rob.
Mm-hmm.
The legalization of vaping and the legalization of cannabis in the same year definitely created some opportunities for people who were promoting both products. You know, the vaping, the impact for vaping was that, you know, Bill S5 was essentially rolling out the red carpet to Juul, is what it amounted to. Rather than to put some controls in place first, like we'd seen in the UK and Europe and elsewhere. So that, and Juul, you know, the vaping horses are out of the barn. And now it's much, much harder to get them back in than it would have been by just putting a few reasonable controls in place back in 2018. But, you know, it is what it is. And now we've got to redouble our efforts and follow our chief medical health officer's advice, PDQ, and get after this provincially, federally, municipally, et cetera.
Yeah, I'm also wondering, because I did a little bit of research on the comparison between the cannabis and the e-cigarette bans. And when I was searching on the internet, I came up with a cannabis industry organization with a document that said, and this is how you get around the restrictions on cannabis advertising. I mean, there's also been a lot of academic speculation that, you know, with time, with the strength of the cannabis industry and its importance, they're actually going to eat away at the prohibitions on cannabis advertising. So it'll be interesting to compare these two as we move forward, I think. Anybody else like to comment on that one?
I think it's, I mean, cannabis and tobacco are different. We should acknowledge that. We can have nuanced substance policy. But to acknowledge that is not to not acknowledge the actual harms that come from particular cannabis use. I think one element of this is that cannabis industry is much more normalized and destigmatized to the point where you have professors of cannabis science sponsored by cannabis industry at some universities. So there is more of an openness to cannabis, perhaps because there's a frustration with the ongoing, the long criminalization of it, to the point where perhaps the pendulum has swung the other way too much, where we are overly permissive out of a fear, whereas hopefully over the next few years, it will start to swing back the other way.
Okay, so we are getting close to time. I do have a couple of additional preset questions. Within the context of COVID, has the political appetite shifted for adopting any of the policy options that we have presented? So I'll ask the panelists that question. We can ask Flory to answer that first. Has COVID had an effect on the attention that governments pay to the marketing of e-cigarettes and their willingness to move forward any further?
In terms of,
Flory, we're not really hearing you well. Can you address your... You know what, let's go to Les first. I think you're having an internet problem, Flory. Les?
Well, I think COVID is affecting absolutely everything right now. And vaping and smoking and tobacco are certainly no exception. So we got to fight a little harder to get our message out there. Some of the medical health officers have been profiling the impact that smoking and vaping can have on the spread of COVID and more severe symptoms among those who are infected. So I think that's helpful if we can draw some parallels there and boost our profile during this pandemic. But you know, it's also the vaping epidemic among youth continues to rage. If our medical health officers are asking governments to take meaningful action on COVID-19, they're also asking our governments to take meaningful action on youth vaping, and we can do both.
Yeah, Flory, do you want to give it another chance?
Is it, I don't know if it's better now, but
yeah.
Okay. So yeah, I don't think it's diminished the appetite, but certainly the same people that would be working on the tobacco file, or many of them in public health and in terms of the public health authorities, are working on COVID. So I think that just there's a capacity issue that's certainly there. And I think too that just in terms of I think everybody's just looking, you know, at what everyone else is doing, and you know, kind of hoping to learn from everyone else's mistakes or loopholes or things like that. I think that things will kind of, you know, there will be a spur of action that will kind of all happen at the same time, but I'm not sure that it's going to happen all right now.
Thank you. Shawn, you wanted to comment on this as well?
Yeah. A few months ago, I had the opportunity to interview a number of advocates, health practitioners, and even government officials. And one of the questions I asked was what role COVID has played over the last few months. And there seemed to be a consensus that, you know, there was plus and minuses. The plus was it provided some people the opportunity to focus on specific issues with less kind of distractions. Because of the shutdown, I guess they were focused on one topic. But I think another kind of a negative, and I think this is more disconcerting, was that particularly amongst the advocates, the access to decision makers, policy makers was reduced, potentially reduced. I mean, it was reduced, you know, with the shutdowns and stuff. They weren't able to go meet with decision makers and government officials and so forth, which arguably led, or that leads to the potential that they're less effective in their advocacy, or put another way, that that government official or decision makers may not have all the information available to them as a result. I guess an aside to that, or maybe a little bit good news of that, is that the advocates and other people have implemented other activities like Zoom meetings and so forth to pick up where they can't go into an office. They're having meetings in other fashions. So people are adjusting, but there has been a noted kind of issue with COVID.
Okay, I think that we are, I've tried to raise all of the issues that were brought up in the chat, and I'll just give an opportunity for the speakers and the panelists for any last remarks, and then I'll sum up. So maybe we can start with Daniel. Any last remarks?
I would just say, expecting anything to come from industry or anything that they can get away with, I would assume that they will with marketing. So if you go from that approach for marketing, I think that's the strategy we want to take.
Thank you. Shawn?
Well, I'll just say that, you know, we do have some good, I guess a good record. I won't say a good record. We do have some good ideas that have emerged out of tobacco control for cigarettes and so forth. And I think we can apply these to e-cigarettes, and even as mentioned, maybe even the cannabis, what's been done with cannabis. You know, take what has worked for cannabis, apply it to vaping. And so a number of jurisdictions, as Les mentioned, across Canada are actively engaging within the policy realm of you know, coming out with new and emerging policies. So I think there is still a critical time right now to reach out to decision makers and policymakers, and even just, you know, public health officials who are advising others, and to discuss, you know, various policy options, the evidence, and so forth. Just you in your own little space can do this, and I would highly encourage you to you know, learn one little area, or maybe you already know that little area, and to communicate to someone else, that maybe we can, you know, one small kind of voice here can lead to bigger changes downstream. So I think we each can play a role, no matter who we are. Thanks,
Shawn. Les?
Well, Rob, I have to wonder what it would take to get government's attention. I thought it would be, I thought after 100,000 kids started vaping, that governments would start moving heaven and earth. And then I thought, well, maybe it'll be 200. Now the number is over 400. And no one's moving heaven and earth here. Not by a long shot. And I'm just comparing it to the efforts we've already taken on tobacco that have been highly successful in reducing youth smoking. So, you know, do we need 1 million kids to be vaping? I'm really just wondering what it would take to light a fire under everyone today, whether you're working within government or not, to come together and do what's very obvious, and that is to align restrictions on vaping with the highly effective restrictions we already have on tobacco.
And Flory.
Yes, I think that we should learn from tobacco, and it's pretty clear that when these products became legal, there was a lack of research and a lack of evidence, and that's informed or led to these poorly informed provisions that we have. I think in the context of resource being limited, of just government's capacity being limited, I think we need to just, you know, overhaul and just close down a lot of these marketing opportunities for industry, and base ourselves on tobacco, go back to what we have for tobacco, which is not a specifically with respect to advertising, it's not a comprehensive or a complete ban on advertising. There's still advertising for tobacco allowed in Canada, but although it's very limited. And build from that. If we need to speak to some smokers just about certain products, let's do the research showing what we need to say, how to do it, and which products should be advertised. And let's have a better, far more targeted approach for these products.
Thank you all to the speakers and the panelists and to the very active participants in the discussion and those who have listened in. There is so much to do here, as people are pointing out. It is terribly frustrating. The evidence is very clear. Marketing brings about young people, be the children or young adults, picking up vaping products and very quickly becoming dependent. There's no question about it. What needs to be done is also very clear. The fact that the governments have not done that raises eyebrows, raises questions. It should make us ask some very cutting questions about why that is, whose interests are being served and why. So we will leave it at that. I would like to thank also Sonia for organizing all of the webinars. I will say those who have participated in all 3 webinars, we will be in touch with you to provide you with certificates, and please feel free to email Emily Taylor at emily.taylor@camh.ca. And wishing you all a wonderful day. Thank you for coming. Bye now.